This is part two of my interview with Dr. Lodhi. In part two, we talk about perimenopause, what age you should be considering hormone therapy, what it is, why you should go on it, and we dive deep. I hope you will enjoy the rest of my interview. If you'd like to hear the full episode on audio, it will be available wherever you listen to your favorite podcasts. I was at a seminar last week, and there was a woman as young as 26 that was there to learn about menopause and perimenopause. And I'm certainly meeting, not quite in their 20s, but women who are in their 40s, 30s, 40s, who know the word perimenopause, which of course I'm 61. I did not know the word perimenopause when I was in my 40s. I had the good luck of having a doctor that put me on a hormone replacement in my late 40s. But how young should we start teaching women about what these signs are? And they aren't always signs of menopause, but they can be.
Yeah. So no, there's been this conversation now, and I think I'm trying to remember if it was ACOG or if it was the Menopause Society, but one of them put out that we should, as gynecologists or as providers, we should really be having that discussion about perimenopause, menopause with women between the ages of 35 and 40, as young as that, because, a lot of women will start to experience symptoms pretty early on. And unless they're aware of what's happening, they may unnecessarily go suffering for a long period of time. And some women can have premature ovarian failure, or we call it insufficiency now. We don't call it failure anymore, but basically where their ovaries shut down before the age of 40, and then they start to have those symptoms. So it's really important for those women in particular to go on hormones because we want to protect their bones and we want to protect, their brain. I mean, like we really honestly want to protect their heart. I mean, the estrogen is not indicated for cardiovascular protection, right? So, well, the FDA has the indications for estrogen as to prevent vasomotor symptoms, which are like hot flashes, night sweats, and to also prevent osteoporosis. But it does not have a medical indication for like protection of the heart or brain or cognitive function or anything. But we know that estrogen does that. Okay, so even though there's no FDA indication for that, we know that estrogen will somebody that's pre-diabetic in the, perimenopause, it can actually prevent them from becoming diabetic. We know it protects the heart. We know that, the receptors in the brain are upregulated for estrogen up until the age of 65. So we know that in this perimenopause time, in this menopausal period, we know that the everything in the body is seeking out estrogen and definitely in the brain. And that's with Dr. Mosconi's research. And so we know that it's really important for women if they decide, like obviously not everyone has to go on estrogen, but if they decide to go on estrogen or hormones, really important that that they can even start before they go into full-blown menopause. They can start even in the perimenopausal time frame.
And just for a second, since I know whenever I mention hormone therapy to anyone, it's like, well, I can't do what my doctor said. I have cancer. My uncle's cousin's brother has cancer. Therefore, I can't go on hormone therapy.
Yeah, so it's really important that we look at the patient themselves. We look at what's going on with them, and if they themselves don't have cancer, really estrogen, especially the transdermal one, the one that kind of goes through the skin, avoids the liver, we know is the safest. We have the most amount of studies on that. And most women can go on estrogen hormone therapy if they want to. Obviously, that is a shared decision making between them and their provider. And, they have to go through the history and all of that. But I would say, honestly, like most women can go on hormones if they decide that they want to. From the studies that we have, we know that transdermal is very safe for women.
And what about testosterone?
Yeah. So testosterone, the indication that we have right now for testosterone is for hypoactive sexual desire disorder. So, meaning like somebody that has decreased libido and it is bothersome to them, then we go ahead and we treat them for it with testosterone. Testosterone is one of the medications that is used for hypoactive sexual desire disorder. We have two others that are FDA approved. Testosterone is used off label. It is not approved, but there was a consensus in 2019 with ISHWISH and ACOG and the Endocrine Society. And so they all came up with a consensus guideline stating that women could use testosterone for decreased libido. There's so much to decrease libido that it's not a quick fix. And you really have to address like all of the things going on in a patient before they can fully get better, I believe. Sure, you can give them a medication, you can give them testosterone and see if that works. But if you're not addressing all the other issues that are going on in their lives, then it's really probably not going to help.
I have a couple of friends who are a bit younger and recently went on hormone therapy, and it was as if their whole life changed. They said everything. I mean, have you seen it where that's simple? And I won't say hormone therapy is simple, but
Yeah.
where it's just the estrogen alone. I mean, I guess some of the research, especially Dr. Mosconi's research, has shown that it's not just the reproductive organs that are being estrogen depleted. It's everything. And so sometimes that
Yeah.
just be the somewhat straightforward, if not simple, solution.
Absolutely. So, we know that there's estrogen receptors throughout the whole body. And so when we don't have the estrogen anymore, it's going to affect all aspects of our life. And so, absolutely, to your point of women going on estrogen and hormones, and does that change their life? It absolutely does. There are definitely women that will come back after they've been on hormones. I'll give you a case in point. I had a woman, she was 44 years old, had been dismissed by all these other physicians because they felt like she was too young to be going through perimenopause, even though she's telling them she's having these hot flashes and night sweats and she's so, miserable and she can't sleep at night. She can't function during the day. She's having a hard time, like she's just absent. And they're like, well, no, you're too young. But, I gave her some hormones. I gave her estrogen and I gave her some progesterone. And we know that anytime you have a uterus, and if you're going to go on hormones, you have to have the progesterone to protect that uterus. So I gave her some hormones and, she came back. I did a follow up after. I usually do a follow up between 2 to 3 months. And so she returned and she said it has changed her life. She feels so much better. She can function at work. She can sleep at night. I mean, who doesn't want to sleep at night, right? I mean, you really need to sleep at night. You really need to protect your sleep to really allow your body to recover. And if you're not getting good quality sleep, then you're just going to be miserable. And, it's going to be very hard for you to function.
I think you bring up a point too that like hormone therapy doesn't have an age. It's when you are feeling like crap and it makes sense. It's worth getting that assessment from somebody to find out if it really makes sense to put you on hormones because you cannot be too young. I think you can be too old, right? It's 10 years either side of when you stop having your period.
Yeah. So, well, okay. So, if we're going by the Menopause Society's recommendations, what they suggest is that any woman that's having like these vasomotor symptoms or whatever in perimenopause or menopause, so within 10 years of menopause or less than the age of 60 is what they suggest. Now, there's been talks. There was a recent article published in October, this past October, by the Lancet. There was these two authors that suggested that maybe we look at changing the recommendations because we know that transdermal, the estrogen that goes to the skin, is really safe. And so maybe women that are now in their 60s that were never on it before, is it okay for them to also consider hormones? And what the conclusion was is that definitely it's shared decision making. So you have to talk to your provider. You have to go over what your medical history is, whether or not it's going to be beneficial to you. The reason why they say within 10 years of menopause is because it's looked at that when there's chronic conditions that are going to form, like hypertension. In fact, somebody's working on a paper right now on the metabolic syndrome of menopause. Basically, diabetes, high blood pressure, cholesterol, all these things that develop as a function of us losing our estrogen and going into menopause. You'll notice that I will tell you that almost every single woman of mine that is not on estrogen has high blood pressure, diabetes, high cholesterol. That is in menopause. I mean, so many women develop that metabolic syndrome because we think that that time frame. The reason why they say less than the age of 60 is we believe that that time frame between when a patient goes into perimenopause and complete menopause, they have almost up to 10 years before they start to really get, have developed that buildup of that, say the atherosclerosis or the cholesterol in their arteries and things like that. And so the question, and, when we know that the arteries start to stiffen up and, the hypertension develops. So we're trying to mitigate all that by giving estrogen. Now, is estrogen preventative therapy? No, nobody's going to say that it is, but it helps with all of these things, right? So nobody's saying to go on estrogen to prevent these things because we don't have that indication, but we know it will help you with heart health. We know that it's going to prevent osteoporosis. We know it's going to prevent colon cancer. We know it's going to prevent this genital urinary syndrome and menopause. We know it's going to help with cognition. We know it's going to help, perhaps it can delay dementia, so these things. So the question is, what is the ideal time frame to go on this estrogen so that you can get the benefits of estrogen? So you don't have these long-term chronic diseases. And that's really the question. And I don't know if we have an answer to that, but right now that's what the guidelines say is less than the age of 60 and within 10 years of menopause. So if you went through menopause, at the age of 55, you still have up until the age of 65, right? To be placed on that estrogen. But again, with that shared decision-making, you just have to decide with your provider, is it going to give you those health benefits? Is it going to be beneficial to you to go on hormone therapy if you've been out, like, say, 15 years, whether or not, is it still going to help you?
But on the younger side, you don't know when you're going to, and just for the audience, define menopause as 12 months without a period. You don't know when that's going to happen. If you're symptomatic, isn't that still okay
Yeah.
to, regardless of how old I am, if
Absolutely.
I'm 40 and I'm huge, as you just mentioned, your one patient that really needed that was, she was young, but she still had the symptoms.
Yeah, absolutely. So if you're having the symptoms, right? You're having that brain fog, you're having the hot flashes, the night sweats, the mood swings, all of the symptoms of perimenopause, then absolutely, would you benefit from estrogen? 100%. Yes, you would definitely benefit.
Right. Thank you. We're running out of time. This was so informative. Anything else you'd like to add besides telling people where they can find you?
What I always like to tell people is that there's always hope, and so I don't want anyone to think like, gosh, I'm out of the time frame. I can't get any help, whatever. I would definitely seek out providers that can help you. Go on the menopause .org website to find a Menopause Society certified practitioner that is near where you live, that can help you with the symptoms that you're having, and really take a listen to the things that you're going through. And especially if you go to a doctor and they dismiss you, then definitely go find somebody that isn't going to dismiss you, and make sure that you get the help that you need. So I really, like to leave people with hope more than anything. So I am located in Chappaqua, New York. I have a concierge practice where I see women for perimenopause, menopause, sexual health. I even see younger women just for, birth control or annual visits or anything like that. I am hosting a retreat in Morocco. I hosted one this past year. I'm hosting another one in 2025. It's going to be September 19th through the 26th. It's called Love and Nourish, and we focus on loving yourself and nourishing your body. And we start every day with yoga and meditation. And we have nutrition lectures that are done by my colleague, Dr. Basma Ferris, who is a dietitian before she became a gynecologist. Then we do cooking classes. And then we also have lectures on perimenopause, menopause, and sexual health and intimacy coaching that are done by me. And this past year, we did it. It was phenomenal. It was amazing. Women loved it. And Morocco is so gorgeous. So we all had a fantastic time. I do telehealth in Michigan. So those that are in Michigan that need a menopause provider, I can definitely help you out. And I have the podcast, the Muslim Sex Podcast, that is not just for Muslims, it's for anyone who wants to just learn information on menopause, perimenopause, sexual health, and intimacy coaching. Lastly, I'm on Instagram and TikTok and all of those things at Dr. Sadaf OB-GYN. I also have a YouTube channel that is the Muslim Sex Podcast. So lots of ways to find me. I will send that all to you, and you
It will
can.
be in the show notes for
Yeah.
sure, for sure. And I'm going to ask you, and I know we didn't really talk about sex, and I'm putting you on the spot, but I ask all my guests their definition of sex.
Wow, that's a good question. It's the ability to be vulnerable with another person, and the ability to give yourself permission to experience pleasure.
I love it. I love it. Thank you so much, Dr. Sadaf. I really appreciate your time.
Thank you. Thank you for having me on. I really appreciate being here.